Let us continue and okay. And we start with our second class with speaking about signs and symptoms. And so on your own, the task here is on your own. Make a list of the signs and symptoms you would expect to see in a patient with pneumonia. So what kind of signs and symptoms can you see? You would expect to see. So is the task clear?
Rising temperature.
Yes, ma'am.
Okay.
Ma'am, grayish nails turning gray can be a sign.
Bluish to gray,
Lips turning gray, and
like cough with fever and chills, ma'am, and difficulty in breathing.
Well, what is it? Is it a sign or a symptom?
Ma'am, it is a symptom, ma'am.
The patient can see it himself or herself. Okay.
Yes.
What else?
Sharp pain in chest.
And
What is
ma'am,
it?
loss of appetite also.
Blue or gray, ma'am.
Shallow breathing.
Okay.
ma'am, dehydration.
Sorry?
It can be a sign. Dehydration can be a sign.
Dehydration
Fast heart rate. Fast heart rate.
in pneumonia, dehydration. Are you sure? I'm not sure, but I'm not a doctor. Okay.
Ma'am, actually, my
Ma'am,
brother
rising temperature in Raju.
he had dehydration.
I see.
He got severe dehydration.
Did you speak about increased temperature?
Yes, ma'am.
Yes, ma'am, it is a symptom.
Yes, ma'am.
Okay. Symptom. What about pulse? Is the pulse rate increased?
Rapid increase.
Yes,
Yes,
ma'am.
ma'am.
It is fast
Yes,
heart
ma'am,
rate.
pulse
Fast. Shallow
rate
breathing.
increase. Ma'am, increase because ma'am temperature
Due to heavy
is
coughing.
increase, so pulse rate will increase.
Okay.
And ma'am,
What else?
greenish or yellowish mucus, that can be a symptom, ma'am.
Ma'am, there may also be loss of appetite and even chills, ma'am.
Yes, ma'am.
And
Chills
this is
sweating, ma'am.
Weakness and loss of appetite.
and this
Bloody
is
mucus.
Yes, ma'am.
is this sign or symptom?
Symptom, ma'am.
Headache in
Symptoms, ma'am. Symptoms, ma'am.
Symptom. Okay.
Shortness of breath.
Good.
Even coughing and wheezing, ma'am.
Yes, of course. Well, very good. You are very good doctors. So let us move on and so speak about the language which is used by doctors while doctors talk to their patients. When you speak to patients, you need to use non-technical language so that your patient can easily understand you. And let us look at two example questions from the case history. And the question is, which verb means precipitate and which verb means start? So they are highlighted here in bold. Let us listen to Aymen. Sentence question number 1. Read it, please.
Yes, ma'am. Ma'am, it's when do the attacks come on? So, ma'am, it is when did they start?
Yes. When did they start?
Yes.
And the second one is for Arun Chalam. Read it, please. Arun Chalam.
Can I, ma'am?
He is
Yes,
not here, ma'am.
I see. Okay. Yes.
Ma'am.
Read. Yes.
Are
Read it.
you aware of anything that triggers the attack, ma'am? It is the precipitate, ma'am, like
Yes.
from where it is originated. It is asking.
Causes, yes, causes the attacks.
The
Or
cause.
anything can
Mhm,
like induces the pain,
yes.
Or
mhm.
increase, ma'am.
increase. ma'am.
Okay, increase the text, yes. So the idea is that you should just use synonyms, the words which are not specifically medical words, so that the patient can easily understand you. Okay, now let us do some practical task. So we should replace the technical words which are given in sentences in italics with non-technical words from the list which is given to the right. So you may have to change the forms of some words, but not of all of them. Okay. So if we have a look at the words which are given to the right, do we understand the meaning of all the words here? For example, book. To book is a verb here. Do you see it? It's not a
To
noun.
book an appointment.
Mhm. Okay. So what about prone? Do you understand prone?
Yes, ma'am.
Yes, ma'am.
What does it mean?
It means
It's
susceptible.
susceptibility, ma'am.
Okay,
Susceptible.
yes, good. Now let us look at the sentences, read them and just replace the words. Madhumita, the sentence 1 is for you.
Yes, ma'am. We are going to have to perform a few tests. We can change it by have. We should have few tests.
What do we do with tests?
Book.
Okay, book is possible. Few tests or just the simple word.
I've got few tests.
Or it can be do a few tests. Yes. Okay, let us listen to Divya, please. Divya, are you here? No answer. Priya.
Yes, ma'am.
Yes, read it.
She's suffering from a bad bout of flu. Ma'am, instead of this, stick to ma'am. She stick to a bad bout of flu.
And are there any other phrases possible to use here?
Ma'am, can I?
So instead of suffering from,
Have got.
yes,
We
have got a very
We
bad.
have got a very bad bout of flu.
Okay. Now let us listen to Rajkumar. No, Rajkumar. Badris. Badris. No. Prerna, please.
Yes, ma'am.
So sentence number what? Number 3, please.
3.
Mhm.
It might be a good idea to refrain from fatty acids for a while. To avoid.
To avoid fatty foods.
Yes, ma'am.
Exactly, you're right. Okay, now Nishat, please.
Yes, ma'am. He is susceptible to many minor illness, ma'am. He is prone to many minor illness, ma'am. Like
Exactly.
susceptible is converted, like changed
Yes.
to prone.
Okay. So now Prakriti. Prakriti is here. No. Samhita.
Yes, ma'am.
So the
You
next
said
one.
cough is intermittent.
Mhm.
It can be. You said the cough is to come and go because
Yes.
irregular interval is intermittent.
So comes and goes, yes, because this is
Yes,
the
ma'am. Because
person.
intermittent means at irregular intervals.
Okay. So the next is for Rafe.
Yes, ma'am. Your cough is persistent. Ma'am, persistent means continuous, ma'am, which is occurring regularly.
Okay, and which phrase from the list can we use instead of persistent?
Stick to.
there all the time.
All the
Yes.
time.
There all the
Yes.
time. Mhm.
Mm.
Okay.
Yes, ma'am.
So I mean, please, the next sentence.
Ma'am, the next is it's difficult to adhere to any kind of life changes.
Mhm.
There means, ma'am, it's difficult to stick to any kind of life
Yes.
change, ma'am.
Okay, great. Now let's go back to Matkumita.
Yes, ma'am.
Okay.
You want Am to be hospitalized. You do not. You
You
can
won't have
avoid
to be
being.
admit.
You won't
Yes, ma'am.
have to be admitted.
Admit, ma'am.
Admit. Yes,
And
ma'am.
we should change
Hospitalizes. Change
the
to
form.
admit.
Admitted.
Admitted. You.
Admitted.
Mm,
Yes,
yes,
ma'am.
admitted.
Admitted. Yes, ma'am.
Mhm. Okay. And Divya.
Yes, ma'am.
Okay.
You are scheduled to see the nurse in allergy clinic next Tuesday. You are
Let's
to
get it.
come and go to see the nurse in allergy clinic next Tuesday.
You have to
Uh,
see the nurse
You're
in allergy clinic.
you're booked to see
Mm.
the nurse in the allergy
Yes, you are
clinic
booked.
next
Yes,
Tuesday.
You are
yes.
booked to
Yes.
see. Mhm.
Book.
Okay. Good. Well, and here we have another task about non-technical language. Use the phrases below to make questions with the non-technical words. Take turns role playing a patient with flu or cough. So you should ask questions like when, is there, do you, does it, did you, have you ever, are you, is it? And here are the examples. So are you prone to something? Are you booked to see? Do you find it difficult to stick to medication? Does your cough come and go? Have you ever had? So I mean, one of the students should be a patient and the other is a doctor, and the doctor should ask questions which are easy for the patient to understand and using non-technical language. Who would like to be the doctor and who would like to be the patient? No volunteers.
No, I can be the patient.
Oh, your name is what? What's your name?
Samhita.
Okay. And the doctor? Yes,
Yes, ma'am.
Rafael? Rafael is a doctor?
Yes, ma'am.
Okay, please, Rafael and Samhita. Start, please.
Uh, I'm Dr. Rafe,
Yes. Mhm.
and how can I help you?
I have difficulty in breathing.
When did it initiate? When did it start?
Somewhere around 2 weeks ago.
Um, is there anything that triggers your
Dust and pollen
triggers your
grain.
allergy?
Dust allergic.
Um, do you have it more frequently?
During time, especially at night, early morning hours or late night, I have it frequently. From
Did you
past 2
take
weeks, I
any
have it.
Did you take any medications for this before?
Herbal
Previously?
remedy. Herbal remedies.
Okay. Uh, have you ever been allergic to anything else?
No, nothing as such.
Okay. Is it regular or irregular
From past 3 weeks, it's regular during the night time, during the late hours.
okay. uh, does anyone from your family suffers from the same?
No.
Thank you.
Mhm. So, and the doctor should say some encouraging words about the procedures that the patient is going to go through in future. Yes, about just prescribing some medicine or doing some tests. Okay. Mhm. And okay, well done. So I like it very much. So, and let us move on and mhm. Now we come to another listening task. We are going to to listen to the last part of the conversation between Dr. Dixon and Mr. Bloomfield when he asked some questions about the general history. We are going to listen and write down the questions that the doctor asked about appetite, bowels, waterworks, and sleeping. Okay, so please make notes about the questions and you tell me how well you can hear. Now I'm starting. Okay.
Problems on that score?
Bowels okay?
Do you hear?
Yes, ma'am.
Okay. Now.
Listening 3. Okay. Do you smoke?
No,
You drink?
just socially. Maybe a couple of beers a week, nothing more than that.
Is your appetite okay?
Yes, I never seem to have any problems on that score.
Bowels okay?
Yes,
Waterworks okay?
yes,
Sleeping okay?
yes,
General health okay otherwise?
yes.
I think we'd better have a look at you. Could you just pop behind the screen and...
So what is happening here? What kind of questions does the doctor ask? What are the questions?
Doctor asks about
Like, is your
symptoms.
appetite is
Is your
okay?
Yes.
bowel movement is okay?
Is your
Water work is
appetite
Uh,
okay?
water work
Sleeping
and
is
sleeping
okay.
is okay or not?
Does he smoke or drink?
Yes.
Yes.
I mean
How
that
is his
he starts
his
with the full form of the question. So is your appetite okay? But then he shortens the questions because it's clear from the context about the form of the question, what he's asking
Yes.
about. So it means that just to make it faster and shorter, sometimes we can omit some grammar forms when we ask questions, for example, like here.
Listening 3.
And let us have a look at the next slide here. We should expand short questions. Example, you been off work at all? And the full form is, have you been off work at all? Let us look at the questions which are given here. These are the short forms, and we should expand them and make it just grammatically correct. Let us listen to Madhumita. The first one, please.
Yes, ma'am. Are you eating well?
Are you eating well? Okay, yes. Then Divya. Priya.
Yes, ma'am. Is your appetite is okay?
Okay, so Prerna. Prerna,
yes,
are
ma'am.
you,
Yes,
are you
ma'am.
here? Yes. Number
You sleeping okay? Are you sleeping well?
And if we use okay,
Or have you been sleeping well or okay?
who can help us with number 3?
Is your sleeping okay?
Sleeping okay?
Is your sleeping okay? Yes. Okay. Nishat, please. Nishat, are you here?
Yes, ma'am.
So
Yes,
number
ma'am.
4. Number 4.
You passing water a lot. Have you passing water a lot? Have you?
Have you been passing
Or-
maybe? Have you been passing
Yes.
water a lot?
Have
Or
you been passing water a lot?
Or are you passing water a lot?
Are you passing water a lot?
It's also possible.
Yes.
Prakriti,
Ma'am, is your periods is okay? Is your periods is okay?
so I think it's better, this is plural form.
Are your periods okay?
Are
Yes.
your periods is okay?
Okay. Are your periods okay? No is here. Samita,
Yes, ma'am. Had any diarrhea? Diarrhea? Are you nahi. Have you been suffering from
Have,
diarrhea?
Have you any diarrhea?
have you had any
Have
diarrhea?
you had any diarrhea?
yes. Have you had or did you have any?
Did you had any diarrhea?
Or,
Yes.
or do you have, as far as this is past, did you have or have you had? Okay, so Rafael, the next one.
Lost any weight? Did you lose any weight?
Or the perfect form is also possible, yes? Have you
Did
lost?
you lost any
Have
weight?
Mhm.
Have you lost any weight?
Yes, ma'am.
Okay, Ayman,
Ma'am, the last one is been living there long, or it can be have you been living there long?
exactly, good.
Yes.
Okay, so you should be careful with this kind of questions while talking to a patient. Now, so the task here, we are going to read some information, the article. And before we start reading it, let us look at the pictures and decide which social problems they show. Which social problems, the problems of society.
Living.
Ma'am, in first A,
Homeless
it seems like
person.
homelessness.
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 Yes.
Then
Sleepless.
Shortage of space. B.
B,
They have to accommodate in a
Shortage
short
of
place.
sleeplessness.
no accommodation. So yes, the crowded, yes.
Yes.
Ma'am, she is
He is smoking
smoking in
Smoking.
She is smoking.
and he is overeating.
Overeating.
Okay.
overeating and junk food. Junk food, crappy
Fast
food.
junk food, yes. So here are the problems, and we are going to read about the causes of these problems. So, and there are some words that we need to pay attention to. So the words such words as deprivation, which means poverty, that people lack of some kind of resources. Then factors, this is causes, incidence, occurrence, plateau. Plateau is used instead of level here. Then pronounced means evident. And social classes 1 and 2. So in the classification of the population for research purposes, the two highest social classes, 1 and 2. And let us look at the first portion of information and listen to Madhumita. Read it, please.
Yes, ma'am. Social deprivation is associated with death from all causes. The most pronounced effect is with circulatory and other smoking-related diseases. A similar trend is seen with infant mortality, morbidity from chronic illness, particularly musculoskeletal, cardiovascular, and respiratory conditions, and teenage pregnancy.
Do we understand everything?
Yes, ma'am.
What is mortality here?
Ma'am, death.
The death rate.
Death rate.
Rate. And morbidity.
Disease rate.
Disease
Yes,
rate.
ma'am, disease rate.
Okay. Now let us listen to another person. Divya is absent, right?
Can I?
Yes. Priya.
Yes,
No,
ma'am.
Priya,
This
read it,
is
please.
not This is not a new problem, nor one unique to the UK. It may partially due to smoking and heating habits, but this disparity was in evidence 80 years ago when those social cases 1 and 2 were more likely to smoke, eat foods high in saturated fats, and take less exercise. Disparity in health is closely related to income. In the UK, an increased proportion of the population is now living on greater than 50 percentage and average income than 20 years ago. The mortality gap has grown proportionately.
Mhm. Okay. So do we understand everything here?
Yes, ma'am.
Saturated fats, what does it mean?
Saturated fats means the high content of fat
Which is
the food which contains
It is not
harmful
breakable,
fat.
ma'am, no,
yes, which is
easily.
not good. Mhm. Okay, and you've correctly pronounced the arrows, the arrow, an increased proportion and less than 50%. Okay. Mhm. Okay, the next piece of information is here. This is for Prerna. Is Prerna?
Yes, ma'am.
Yes, read it, please.
This has an impact on general practice. There is a higher incidence of illness, an increase in requirement for primary care team services, and the increase of out of hours and A&E services amongst deprived communities.
Mhm. And this arrow, this horizontal arrow,
Towards.
Forward.
towards
Towards.
leads to increased
Towards.
requirement. Okay, and this abbreviation A&E. Service.
Accident and emergency service.
Okay.
Yes.
Good. The next piece of information. Just a minute. So is for Nishat.
Yes, ma'am. Like other factors which have an effect are homelessness, sleeping rough, employment and unemployment, divorce and immigration status. The adverse effect of living in temporary accommodations are well documented. For example, adults have a increased incidence of depression than people of similar social standing in their own homes.
Mhm. Okay. So, and we have the words employment and unemployment. What is the difference?
Like unemployment, those don't have job, like unemployed does have job or like they're working for living.
I see. Okay. So I think everything is easy to understand. Okay. And the next piece of information is for Samita.
Yes, ma'am.
So read it,
Children
please.
are, children are less likely to receive their immunization, more likely to have childhood accidents, and have higher incidence of minor and diarrheal diseases. Among those sleeping rough, poor diet, poor accommodation, and a lack of access to medical services are universal problem. A study done in 1986 in London found one third are psychotic, a quarter have severe physical problem, and two-thirds have no contact whatsoever with medical services. Evidence show that if services are provided, homeless people will use them.
Mhm. Okay, so here there is information about the reasons for homelessness, right? And so the next piece of information is for Afe, please read it.
Yes, ma'am. The effects of work have been compared to the effects of effects of vitamins. We need a certain amount to be healthy. Then there is a plateau where extra doesn't work and too much is harmful.
Great. Okay, so this is the information that we've read. And there are several questions here. So I mean, the first question is for you.
Yes, ma'am. What main social factors are given? Social factors like poverty and all, employment, unemployment and employment are given, and about morbidity and mortality rates. These are social factors. I think.
Social classes.
Yes, ma'am. Social classes as well.
Okay.
Like, and also, ma'am, smoking and unhealthy lifestyle.
Okay, great. So, Madhumita, the next question,
ma'am.
please.
Can you give your own reasons why those in social classes 1 and 2 were more likely to smoke 80 years ago? Because they were easily available to that, ma'am. That was easily available, that was cheap. They can easily afford that, so they were more likely to smoke.
Well,
Also, they ate food which had high saturated fats.
Yes.
So you are speaking about valuability of smoking nowadays, right? But for example, 80 years ago, it was not so easily to get. And that is why the representatives of social classes, of higher classes, they were more likely to smoke because they could afford this and that was fashionable, right? Now, so people prefer like healthier way of life. Okay, so and let us listen to Priya.
Yes, what reasons could you give for the increased incidence of depression in those living in temporary accommodation? Ma'am, for depression, the poverty, ma'am, the first reason, and the and the diet which they used to prefer.
Okay. And why are they living in temporary accommodation? What's the reason?
Unemployment, homelessness.
Maybe they have moved from one place to another.
Yes, from the type of immigration.
Yes, migration. Okay. Well, and Prerna, number 4.
Yes,
Are you
ma'am.
here? Yes.
Yes, ma'am. Why is poor diet a problem among those sleeping rough? Due to unhealthy food, it takes time for the digestion and it can disturb the sleeping habits of an individual. And also at that time, people used to smoke and eat unhealthy food. And also some are homeless.
Inefficient nutrients.
Yes.
Basically, they malnourished.
And they don't
Increase in the
Lack
fatty
of like
saturated
main
food.
nutrients.
They lack good nutrients because they
Yes,
eat
ma'am.
most of junk food.
And why do they eat such food? Because they don't have cooking facilities, yes?
Yes, ma'am.
Yes.
Okay, so thank you. And yes, so here we're going to speak about the home task. This is, as you see, the same site, English for Healthcare course, online course. And so for the next week, the task will be week 3. You should work with week 3 and you should submit the screenshots which show that you have completed week 3. So I think it's clear.